I would like to welcome all of you and thank you very much for taking the time to participate in this webinar, which I hope will be interesting for anyone who follows in these conference-less times. Most of the areas we will cover stem directly out of published work of our guests during the recent years, with a spin towards continuous objective measurement and more so towards PD Monitor. PD Monitor is a CE-marked Class 2A medical device brought to market by PD Neurotechnology. Sometimes I may use quotes from your publications in order to stimulate discussion. I am sure that the participants in this webinar will be as excited as we are about these topics. And without further ado, I would like to introduce you to our guests in alphabetical order. So we have Angelo Antonini, Professor of Neurology and Head of Parkinson and Movement Disorders Unit at the University of Padua in Italy.
Hello, everyone.
Hello, Angelo. Thank you for being here. Per Odin, a Professor of Neurology at the Lund University, Sweden, and the Head of the Department of Neurology at the Central Hospital in Bremerhaven in Germany.
Not anymore. Not anymore. You have to skip Bremerhaven.
No. Sorry, Per. So
only Lund.
Just Lund, therefore.
That's right.
And Heinz Reichmann, Professor and Chairman, Department of Neurology, and Dean of Carl Gustav Karus Faculty of Medicine at the Technical University of Dresden in Germany.
Hello, everyone. Hello, Spiro.
And myself, Spiros Konitsiotis, Professor of Neurology at the University of Ioannina Medical School in Greece and Medical Director of PD Neurotechnology. At this point, I would like to disclose that our three guests have served in PD Neurotechnology's Medical Advisory Board. So, Angelo, Per, and Heinz, it is a true honor to have you with us today, and thank you so much for your participation. So let's start with the first part of our webinar. The paradigm for PD treatment has been undergoing small but yet sustainable substantial changes in recent years in an effort to sustain the anti-Parkinsonian benefits of levodopa, which is the cornerstone of treatment. Thus, combination treatments, add-on treatments have evolved. Advanced invasive treatments are being proposed in earlier stages of the disease, and based on new evidence, personalized treatment is now emerging as more relevant than ever in Parkinson's disease. So in this context, the recent introduction of medical devices that enable objective measurement of patient symptoms has started a discussion around their integration in the care pathways of PD patients in an effort to objectively quantify symptoms and more accurately navigate through treatment options in the course of the disease. Now, one of these options is PD Monitor. As a reminder for the webinar participants, PD Monitor is an ecosystem for continuously monitoring Parkinsonian patient symptoms either at home or at hospital. It consists of 5 lightweight monitoring devices, let's say 5 sensors that the patients wear on different body parts. And there is the PD Monitor Smart Box and Cloud that incorporate state-of-the-art algorithms to detect and quantify all motor symptoms, practically all motor symptoms, where the patients perform freely their daily activities wearing the devices. Now, based on those symptoms and complementary information from the patient mobile application, the physicians can use the PD Monitor Physician tool to have a very comprehensive visual representation of Parkinson's disease-related symptoms, and they can modify therapy accordingly, especially in those social distancing times because of the pandemic situation. So it is a mobile health paradigm that emerges, which may change the way we treat Parkinson's disease. So after this introduction, let's start with our discussion And I think the first question will go to Per. Per, in a recent paper of yours published earlier this year, you present an algorithm for dopaminergic treatment. Among other options, as the disease progresses, the use of smaller and more frequent doses of levodopa is suggested, or increasing the strength of individual doses, or making a different combination of treatments. How do you envisage treatment modification in the objective measurement area? I mean, what will be the back and forth mechanism to optimize dosing? And how is this potentially supported by devices like PD monitor?
Well, I think the most important thing here is that objective monitoring will give us much better possibility for effective modification of any Parkinson therapy. And we will then have objective and quantitative information about the patient's status over time, and that will be a very important basis for optimizing the treatment. Probably it will also be so that we will do more frequent monitoring than we are presently doing, and more frequent treatment modifications. But of course, this also depends on the healthcare resources and the information that we collect over objective monitoring must be processed, and the treatment decisions made by the doctor also. But in total, I think this is probably one of the most important steps forward in Parkinson treatment in the last years and decades.
Thank you, Per. So I think the next question will be to Heinz. Heinz, it is evident in literature that treatment in Parkinson's disease is or should be very personalized, with a focus on patient symptoms that are more bothersome to the patient, which differ in different stages of the disease. How is objective measurement expected to personalize treatment decisions? And how important is to be able to compare the present situation of the patient with the previous one? Or after you make a change in treatment, you may want to see the effects of this change. So do you expect this to affect personalized treatment in Parkinson's disease?
Well, yes, I agree with you that it makes a big difference whether a patient is still in business or retired, whether there is tremor or not, whether there is fluctuations or not. And this is, for some patients, very bothering to have a little tremor. I have a very famous patient who is a watchmaker. There it is a disaster. For someone else, it's not so bad. And also, it is sometimes really difficult for us, even if we know the patients, to compare what he told us 3 months ago, his situation 3 months ago. Of course, we have scales, and what he reports now. And he may tell you it's a disaster, and in reality, he has a depression, and his motor abilities are very well. So I think for these reasons, it is extremely helpful to have measurables such as the PD monitor that is a more objective measurement of the situation of our patient. And with this in hand, I can really focus on specific problems of a given patient. So I think not only taking the history, asking caregivers, our third help will be now these monitoring systems. So I agree, this will be very helpful to deal with our patients.
Right. Thank you. Thank you, Heinz. So let's ask Angelo the next question. Angelo, in your opinion, what is the value of monitoring the symptoms on a continuous basis at home compared to a Halter-Like approach? I mean, in the first case, the patient is in his natural environment at home, performing his ordinary daily activities, wearing the sensors, and this can be repeated as needed in the future, as much as needed, while the Halter-Like approach is a single use, like the Halter device in cardiology, no comparison with previous recordings. What do you think? What is the best way of using objective measurement?
Well, I think in a disease like Parkinson, ideally you want to have different evaluations over time. I think the problems of Parkinson cannot be solved forever, and the disease is dynamic, so it changes. So I think a system like this and would be ideally utilized regularly. I mean, to complement the medical assessment in person. And I think collecting data at home, maybe 4 or 5 days every month or every other month, can let the doctor and the patient have some more objective evaluation of the clinical state. And this may have medical consequences because you may actually change medications at time of visit or might trigger actually an intervention. So in my opinion, with some exceptions, which may be related to specific events in the person's life, this system should be used on a regular basis.
Okay, makes sense. Thank you, Angelo. I just have to remind that everyone, please feel free to interrupt and make comments on, say, your own opinion if it is different from the speaker's opinion. So now let's see two figures, and I will ask, yes. So these are algorithms for treatment options in early, and the other one is advanced Parkinson's disease from a paper by Heinz. So the current protocol requires a visit to the physician in order to effectuate suggested changes, while validation of treatment efficacy after the intervention is a matter of a tedious back and forth actions with the patient. So Heinz, since this is from one of your papers, how do you see this paradigm change with the support of PD Monitor, especially in those social distancing times that we're living now? What are the specific choices as shown in those figures that are perhaps made easier with PD Monitor in a telemedicine context?
Well, in both figures, we have put forward our algorithm. The same was done by PartA, this was done by Angelo, and all of us have summarized our own experiences here. But I think what we all do in PD is that we make a stepwise treatment. That means we start with a certain substance that we think is the most appropriate one for the patient. But sometimes we know that this may not be sufficient with respect to dosage or with respect to the right substance. So I, for instance, tell my patients if you have a look on the left-hand side, if the MAO-B inhibitor is not potent enough after 2 to 3 months, I would like to add, for instance, a dopamine agonist, and to find out whether this is necessary or not. Certainly a device that tells me whether the mobility has really improved or not might be very helpful. So I think coming from one treatment and going to the next one, the in-between discussion, is it necessary or is the previous one sufficient already, could be really improved by the use of variables such as the PD Monitor.
Right. So to continue on the same subject, let's ask Angelo about combination treatments. When it comes to combination therapies, can this trial and error approach, I mean, while we test the best mix of the combination, could this procedure become streamlined faster with objective measurement, with PD Monitor?
I think there is not so much difference, I think, across all stages. Of course, capturing off time is always a challenge, particularly in the early phases of fluctuations when patients are not very well instructed to understand what is an off period. So I think in this sense, yes, maybe introducing a COMT inhibitor or a MAO-B inhibitor to the treatment schedule, or changing the dose of the dopamine agonist or the number of levodopa doses. All of this could be helped by a more objective assessment, real life, because what we do normally in the clinic is ask the patient what if he or she remembers if she or he experienced periods of inadequate mobility, but having some objective assessment definitely could probably help us prescribing the most appropriate medication at the best time.
Right. So, Per, you published a study last year, a very interesting one, in which you suggested that non-motor fluctuations decrease as the disease progresses. Would you say that this means perhaps that motor fluctuations are a better indicator of treatment fine-tuning as patients reach more advanced stages of the disease?
Well, we were looking in a European collaboration on what we call late-stage Parkinson, defined as Hunenjar 4 to 5 in on. And we looked at those patients to see if they still have an L-DOPA effect. That is a quite common question. Right. And if they have motor fluctuations. And most of them had some degree of L-DOPA effect and also had some degree of motor fluctuations. Then we looked on the non-motor side, and we could confirm that many of them also have non-motor fluctuations. But both the motor and the non-motor fluctuations have lower amplitude here than earlier in the disease. So the impact is maybe less pronounced, but most of the patients have motor and non-motor fluctuations. And of course, here, like in other phases of the disease, motor fluctuations are much easier to monitor than non-motor fluctuations. Right. So I think that a monitoring system is very usable also in the late stage of this disease to be able to optimize the therapy there. Right. And the big thing with optimizing therapy there, by the way, is giving enough dopaminergic treatment.
Well, yes, thank you, Per. Now, in terms of increased accuracy provided by the objective measurement device, do you think that the 5 wearable sensors provide better accuracy since they monitor practically every aspect of motor behavior and bilaterally, comparing to devices that they use, let's say, only one sensor in one arm, for example?
Yes, for sure. This is, as we all know, not always a symmetric disease. It can have different appearance in arms, legs, and left and right side. And also, if you only monitor one arm, for example, it can be very difficult to say something about walking and freezing and balance and so on. So it's definitely an advantage to have more than one monitor.
Right. So the next question will be for Angelo, I think. Since PD monitor captures fluctuations in a very quantitative manner, how useful do you think, Angelo, this would be in the later stage of the disease, especially since these patients may have a greater difficulty in reaching the hospital for a routine visit? Could this also be another complication? Yeah.
This is definitely something very relevant these days. For instance, during this period of during the months of COVID-19 infection, people had difficulties in coming to the hospital. They were concerned. The visits were reduced and limited only to the acute conditions. So Parkinson is frequently not viewed as an acute condition unless there is a dramatic worsening. So these patients were home and their mobility aggravated. I think that if you do a telemedicine consultation like we have been doing, you will not be able to capture the full status because you don't have the patient with you. You look at the patient through a camera. You can ask the patient to walk, but frequently the quality of the connection at the patient home is not ideal. So it is even more important when patients are not physically able to reach the hospital, because in that sense, I think it is really mandatory to have some indication on how things are going, because it is one thing to do UPDRS or just simply finger tapping. One thing is to look at people walking pattern in their home. This is not so easy with telemedicine with a camera. because you don't have a full 3D view. And
right.
so for advanced Parkinson, it is, I think, important because when they are in the late stage of the disease, many times they cannot reach the hospital, but also in case you want to use telemedicine, I think you need to integrate it with some objective measure.
Right. So in general, I think it seems that the pandemic was an accelerator of all digital things to happen from, education and universities to patient care. Now, let's ask the next question, or comment rather, I would say, to Per. All those objective monitoring devices, and especially PD monitor, embraces what is called the 4P, the 4Ps of mobile health technologies. Namely, those are being proactive, preventive, personalized, and participatory. So I think for many of us, this will sound, without any meaning, but do you think that those modalities have a value, let's say, such as the participatory function, which is enabled in PD monitor through the patient mobile app, where the patient can input his opinion on how he is, and also can receive a feedback to see a graph about his situation. I would like your comment, Per, on this. Do you think there's any value on this idea?
Yeah, this is my interpretation, but I think the system will give information about the patient's personal situation earlier than you would otherwise detect it. In that way, I think it can be called proactive. It also involves the patient more in the treatment and makes it possible to give him a more individual treatment. So in that way, one can say that it is personalized and also participatory. It's really involving the patient. And preventive, well, it prevents that the patient comes into periods of unnecessary suffering by making an optimized treatment possible at an earlier stage.
Right. So something similar again for Heinz now. A PD monitor provides an image, a visual representation of the disease symptoms in time. So how helpful do you think this is for everyone involved to share a common, objectively and quantitative understanding of the situation? Now I think we can see in our screens the main screen of the physician tool, which is what the physician will see on his monitor, on his computer or mobile phone. And this is a visual representation of the fluctuation of symptoms, of the intensity of symptoms. Do you think, Heinz, that this visual representation is also good to improve communication between doctor, patient, and caregivers?
Yeah, well, I personally, I'm a very visual type. I need to see something to understand, not only listening to somebody explaining something to me. And I also think that such a screenshot as we see here makes it so easy to say relatively good with lots of green colored fragments of the day, or not so good with the reddish. And then you can also see when the patients went to bed, whether there was dyskinesia or hypokinesia. We also have the inclusion of the treatment and the efficacy of the treatment. Does the patient respond to a certain dose that he swallowed? And I think also sometimes in my outpatient clinic, the patient tells me I was quite all right, and the caregiver tells me, don't listen to her or him. He was awful. He could not move at all. And this discussion between patient and caregiver can also be much more objective when the caregiver can also see a screenshot like we see here. I think it is not only for the patient and the treating physician, but also for his caregivers, a very nice and useful tool. So I'm very fond of such things such as visualizing problems.
Right. I think you're right. And doctors would like to see visually things and not just depend on raw data, numbers, or things that cannot be, do not have a meaning from the beginning. Now, to stay again on this physician tool, Angelo, the next question is for you. The physician tool also have what we call a grouping functionality, which means patients are split in categories based on the degree of change of their symptoms in the most recent monitoring period compared to the previous one. And this is depicted by the small circle that you see beside the name of each patient. So, for example, if this dot is green, it means that there was not a big change since the previous treatment, which means that perhaps the patient is doing fine. If this dot is red or very red, means that there was a significant change from the previous recording, so something has changed to the worse. So do you expect this functionality to help the treating physician to better manage his time, especially if he's a busy clinician and follows many patients with Parkinson's disease?
Yes, I think to have something which could be easily understood at first look, I think is very important because frequently we don't have tools that are easily applied and implemented to highlight different differences in management. I think the condition of the patient is easily depicted here. And this could be also of help in shortening time of the visit. I think sometimes we feel that this technology-based wearable or sensors could make our life more complicated. But in reality, I think if we can just open up the patient chart and see what the changes are and immediately associate the color with the condition, this will definitely facilitate management and actually give the physician and the patient more time to discuss the real problems.
Right. And then if you choose that you have to see closer what happens to one patient, then you can open his chart, and you on the first screen, as you can see here, you see four panels. The first one indicates the percentage of off score, which is very important because you may realize that he's 60% of the time, let's say, off, which is obviously something that needs to be...
Yeah, definitely. I think this is quite straightforward. I think you can look at the proportion of time that person has spent in off, the slowness, the lack of movement, meaning the person has not moved a lot, or even if there are involuntary movements, these kinesias, in this example, maybe not so much, but maybe different in another patient. Right. So I think this is to have a snapshot at the clinical state of the patient. I think it's quite important.
Right. Thank you. So the next question is for Per, because I admit I took some data from a paper of yours, Per, that was published a couple of years ago about, it seems that 30% of those living with Parkinson's disease are of working age, and the majority of them will leave the workforce within 5 to 10 years, which is significantly earlier than the general population. So since you were involved in this study, Per, what do you think is the impact of early diagnosis of wearing off and subsequent, I guess, proper treatment of this? Could you comment on the importance of motor complications to work productivity, and so the impact use of monitoring devices like PD monitor could have on this problem?
Yes, I think that early detection of motor fluctuations in patients where you as doctor do not yet know that they have fluctuations will be one of the most important indications for monitoring, to run it in patients where you do not really know if they are fluctuating. Right. By detecting fluctuations and by treating the fluctuations, maybe before the patients understand that that is their problem, you can surely improve their possibilities to live a normal life, and certainly also to stay in work and to be effective in work.
Right. Thank you. So I think the next question is for Heinz. It seems the ultimate goal for Parkinson's disease care should be the improvement of life satisfaction, as it is called. So the identification of any factor that has a direct impact in life satisfaction is very important. So again, I think, Heinz, you already discussed about this. How do you see this being impacted with PD Monitor? I mean, if we can identify the exact nature of the problem and describe it in time and space, and by space I mean what happens in terms of symptoms in different parts of the body. Hopefully, this will help us better treat it. Any comments on that again?
Yes, well, I think the measurements that are possible with the PD monitor are manifold. As you said, we can focus on the upper extremities. We can also discuss problems with walking, lower extremities, and also we get information on gait. We also see something with respect to balance, which is a problem in later stages. So if we get an indication that the patient, the postural stability is worsening, I think this device is very, very helpful for us to find the right approach to improve the conditions of the patients. Also, somebody who is, for instance, a piano player and can walk forever is still not satisfied if we do not improve his dexterity. So with this modified to the previous tools, with this modified tool, we really get a wonderful information on many, many issues that are really important for the life satisfaction of our patients. So I think it's a very useful tool. And also, it is also a psychological tool. In a time like now, where some people were dared to come to the hospital with the device, they knew I'm still in contact with my treating physician, and this was certainly helpful for the patients. They were not alone. They knew that they can approach us. So I think if something like the corona pandemic will happen again, having something like that will be very, very useful.
That's right. They will make them feel a lot safer.
Exactly.
A safety net. They have communication with their doctor, and we'll see what happens. Yeah,
yes.
Right.
They are not alone.
Right. So now I think we should talk a little bit about falls. And this question will be for Per. As you know, among other things, PD Monitor can very accurately measure off score, but also the number of freezing of gait incidents per day and gait-related symptomatology as well. So how important, Per, do you think is this when you treat advanced patients where quantified targeting could help better manage these patients to avoid falls if you have this kind of information?
Well, I think that detection of freezing of gait and other problems with walk and also falling is a key component when we try to optimize pharmacological treatment and also non-pharmacological treatment in Parkinson. These are symptoms that also have a strong effect on quality of life, and it is therefore clearly worthwhile that PD Monitor, apart from the off score, also covers these functions.
Yes, right. Thank you, Per. So I think it's a final question for part A, and I think this will go to Heinz because it refers to Germany. A lot has been said about this new digital health aids where the whole world is entering now. And the case of Germany's new legal framework regarding digital health applications, known as DIGA, I think that's how you pronounce it. DIGA is very important because essentially it seems, from my understanding, that telehealth is reimbursed for the first time. So, Heinz, do you see information technologies to be used for the monitoring and management of Parkinson's disease patients more so in the future? And perhaps this is the case for PD monitor, where eventually we will see a clear mobile health protocol emerging in the treatment of Parkinsonian patients?
Well, I think it's the perfect time for companies such as PD Neurotechnology, because out of the crisis, everybody is now discussing we need more digital information. We have to improve our digital healthcare. And my center here in Dresden has received a huge center grant exactly for doing so. So telemedicine devices that are with the patient that inform us the blood pressure is too high, the glucose content is too low, or the mobility is not good, are very much in the focus of the politicians. And because of this, we succeeded in getting reimbursement for things like that. So if we make a teleconsult, if we watch the patient, and this is not only true in PD, but in many other neurological disorders, we can arrange nowadays reimbursement from the insurance companies. And because of that, more and more treating neurologists are open to this new field of diagnostic tools and treatment tools, because in former times they were a little bit hesitant. They were afraid it takes so long, it's maybe difficult. And I have my outpatient clinic and practice, and in addition, I have to do this. Now with the reimbursement, they are much more open. So it's not only us, the academic institutions, but also now more and more of the common neurologists that are very open to this kind of variables and objective measurements.
Okay, right. So thank you, Heinz. So, well, actually, I think that with this question, we concluded part A of our webinar now, and summarize what we had so far about the possible shift in the paradigm of treating Parkinson's disease because of the introduction of continuous objective measurement and especially PD monitor, and how this could be beneficial to the quality of life of the Parkinsonian patients and the society, but also for the physician as well. I think I will close this webinar, which actually happened these conference-less times and social distancing times. So I would like to thank you, our participants, Per Odin and Heinz Reichmann and Angelo Antonini. Thank you very much for sharing your views on this topic and how the whole landscape could be changing, catalyzed, I think, by this pandemic situation. And thank you very much for your kind participation in this webinar, and a big thank you to everyone who has potentially and patiently watched it.